Hello and welcome. Today we'll be discussing a topic that affects many men, yet often goes unnoticed: prostatic intraepithelial neoplasia, or PIN. We'll explore what PN is, its potential causes, how it's diagnosed, and what it means for your health. Understanding PIN is crucial for proactive prostate health management. While the exact cause of PN remains elusive, researchers have identified several factors that may contribute to its development. These include age, as PN is more common in older men. Hormonal imbalances, particularly the levels of androgens like testosterone, may also play a role. Genetic predisposition and dietary factors are also being investigated as potential contributing factors. It is important to remember that having any of these factors does not guarantee the development of PIN, but they can increase the likelihood. Now let's delve into the pathophysiology, or how PN develops at a cellular level. Think of the prostate as a gland made up of tiny tubes called acini. In PEN, the cells lining these acini undergo abnormal changes. These cells appear more like cancer cells under a microscope, but they haven't invaded the surrounding prostate tissue. This makes PIN a pre-cancerous condition. The abnormal cells are still confined within the acini, which is the critical difference between PIN and prostate cancer. Understanding this distinction is vital. PN is a relatively common finding, especially in men over the age of 50. Its prevalence increases with age, meaning it's more frequently detected in older men undergoing prostate biopsies. While exact numbers can vary depending on the study and population sampled, it's estimated that PN is found in a significant percentage of prostate biopsies performed for elevated PSA levels or other prostate concerns. It's worth noting that PN itself is not a disease, but rather a marker for an increased risk of prostate cancer. The tricky thing about PN is that it rarely causes any noticeable symptoms. In most cases, men are completely unaware they have it. PN is usually discovered incidentally during a prostate biopsy performed for other reasons, such as an elevated PSA level, which is a protein produced by the prostate that can indicate prostate problems, or abnormal findings during a digital rectal exam, where a doctor physically examines the prostate gland. This lack of symptoms underscores the importance of regular prostate screenings, especially for men at higher risk. The diagnosis of PN is solely based on microscopic examination of prostate tissue obtained through a biopsy. A pathologist, a doctor specializing in diagnosing diseases by examining tissue samples, analyzes the tissue under a microscope to identify the characteristic cellular changes of PIN. The pathologist will then grade the PIN to help determine the level of concern and guide further management. PN is classified into two main categories: low-grade PN and high-grade PN. Low-grade PN is considered less concerning, as it has a lower association with the development of prostate cancer. High-grade PN, on the other hand, is considered a more significant risk factor and warrants closer monitoring. The distinction is based on the specific cellular abnormalities observed under the microscope. The grade of PIN significantly influences the subsequent management strategy. Currently, there is no specific treatment for PN itself. Instead, management focuses on monitoring for the development of prostate cancer. For men with high-grade PN, doctors often recommend repeat prostate biopsies to rule out the presence of undetected cancer. Lifestyle modifications, such as adopting a healthy diet and regular exercise, may also be recommended to promote overall prostate health. In some cases, medication may reduce the risk of cancer development, but this is typically reserved for men at higher risk. Since we don't fully understand what causes PIN, there isn't a definitive way to prevent it. However, adopting a healthy lifestyle can potentially reduce your risk. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, while limiting red meat and processed foods. Regular exercise is also beneficial for overall health, including prostate health. Maintaining a healthy weight and avoiding smoking are also recommended. Regular prostate screenings, as recommended by your doctor, are essential for early detection of any prostate problems, including prostate cancer. The prognosis for men with PIN is generally good. PN itself is not cancer and does not directly threaten your life. However, it does indicate an increased risk of developing prostate cancer in the future, particularly high-grade PN. Recent research focuses on refining our understanding of the relationship between PIN and prostate cancer, as well as developing more precise methods for identifying men who are at highest risk and would benefit most from early intervention. Studies are also exploring novel biomarkers that could help predict the progression of PIN to cancer.